Hello, it's Victoria at The Mother Well, and I'm here today with another peek inside the Birth Doula Client Workbook. You're going to watch me having a video call with a mom who kindly agreed to walk through the workbook with me, let us record our conversation so you could see how it actually might work in a client situation. Now, the one caveat I will give is when I recorded this, I did not realize that I was recording our faces as the small little box on the side of the screen, so I apologize that part of the video is smaller than I wanted it to be, but I do hope it's going to give you a really good look at some of the pages in the workbook, show you how I might guide a client through the workbook, using it as a springboard for our conversations. And you can see how it really is an aid to parents in their birth planning. So without further ado, here's the video. On the left here, you see an example of the non-drug comfort measures that you might want to use in labor. And what I'm mainly curious about on this page is there anything here that you're like not interested in? Is there anything that you're like, don't do that with me?
I've kind of looked over these a little bit,
Mhm.
and I pretty much kind of agree with all of them. The non-drug comfort measures to a certain extent. Probably the TENS unit. I have used a TENS unit before, like with chiropractic, but not like the rest of them I've looked into. And like I have a birthing ball here. I'm probably gonna buy my own peanut ball just because after I was told that I couldn't get one at the last hospital, I'm like, I'm not taking these chances.
So you're saying like bringing your peanut ball
Yeah.
because of the last experience of it not being available. But were you
Yes.
saying, like, for the TENS unit, were you saying that's something that you're not interested in, like everything except the TENS unit, or like maybe?
Well, I've read people, like I've read stories of people who have used it. And like I said, I have used one before when I was pregnant with my son. I was going to the chiropractor.
Okay.
And they would use one on me sometimes. And I just like, I don't know, like I guess maybe it would work, but to me it kind of throws me off because it's like, I guess it's kind of redirecting pain. I just like,
Yeah.
I don't know. It's not that it throws me off. Like I would, if it was offered to me and I was like, well, I'm willing to try anything. Like I'm willing to try anything once.
Yeah. That makes sense. No, and that's cool. Some people, the TENS unit too, that's not typically something that I've not seen so far, like hospitals have available. That would be something like if you're using a doula, right? Like a doula might bring with them if they have, or you would bring yourself. But if it's something, a TENS unit does feel different in labor because just like you said, like it's redirecting pain. That's exactly what it's doing. It's kind of creating sensations on your back for your body to produce more endorphins to kind of counteract the those labor waves that you're having. But it's kind of in my experience, I would say it's like 50-50. Like half the people who use it are like, oh, that was kind of helpful, and the other half is like, I kind of hate this, get it off of me.
Right, yeah, kind of like a birthing tub. Like I've heard some people be like, "Oh yes, this helped me so much," and then I've heard of people like getting in and being like, "No, no, I can't do this."
Yeah, and that's kind of the trick, honestly, with any of these non-drug comfort measures. Really, the trick is just knowing they're there and knowing you can try them. So just we'll talk, just because you've had an experience prior where the hospital didn't provide everything they said they would provide, you and your partner can kind of go through and say, well, hey, what do we know we can give for ourselves? Like you've already mentioned a birth ball and a peanut ball. How can I, if I need heat and cold, right? You can bring a heating pad or a heat pack with you. You can bring one of those cold packs that they have, those baggy, or get a baggie from the nurse's station. You can fill with ice and like put that. Sometimes cold feels better on more intense pain. Heat feels better on softer pain. So, you might go through, you might ask your provider, like, how many of these have you helped your patient use in labor? You can call, we're not, during COVID times, we're not really doing those like labor and delivery tours anymore, but you can call the L&D desk and say, hey, what all, I want to use these things. Do you have this available? And they should be able to answer that question.
Yeah.
You can call the floor. If you're working with a doula, right, oftentimes doulas can kind of help make all of this happen really efficiently. But if you're doing it yourself, just have a plan. Know this is all that I want, and to be able to use if possible, and is that available? Um, and then of course, like there's drug comfort measures also. This is sort of all the major medications you could come across. The one thing I'll say is nitrous oxide, not in our area locally, right? I know some hospitals do have it and some don't. So that's just something that nitrous oxide is laughing gas, basically. So you can ask at your facility if they have that available.
Yeah. I have thought about that one. Because like I'm really not open to any IV pain medication. And of
Yeah,
course I don't want an epidural.
right.
In the event that it leads to another C-section, which I've got criteria for that. Like,
Yeah.
but I would be open to a spinal block. I don't want to be put under anesthesia again at all, unless it's like life threatening.
Emergency. Yeah. And that truly should happen. Like that just have less than 1%. Like that truly is very, very rare that you would need general. And yeah, if I'll say this too, like if you have an epidural, which again, from your prior experience, it's good for you to know, they can give you a bolus of epidural medication. That might be something if you're going into a cesarean and you already have an epidural placed, it's not a bad idea to confirm, like, hey, what are you doing to like give me adequate coverage? What's your plan if we get into the C-section and I tell you I'm having more pain than I want? I don't want to be knocked out. I don't want drugs that are going to make me forget this, but like just give me adequate pain coverage through the epidural catheter. Or if you've been unmedicated, typically what I see is the spinal block or a combined spinal epidural block. Basically, the spinal block is just, it's the same concept as an epidural in that it's going in like kind of generally the same space, but it gives you that immediate relief. It's only good for about 4 hours, which is why if you've been unmedicated, they might do a spinal to kind of get you through that surgery, but it's like instant, you don't feel anything, then you recover. The combined spinal epidural, it's like you're getting like 2 in 1, sort of. You're getting that instant immediate relief, but then there's also an epidural catheter, which is providing that constant medication for longer, so if you had a surgery, but you're like, I'm really worried about recovery, they might set it up so that you can also get continuous pain medication if needed, and you can ask about that. That's a great question to ask, not necessarily in labor, but that's a good question to ask prenatally.
Oh yeah, definitely.
What does your anesthesia team usually do if I'm unmedicated? What does that look like? And of course, there's like very, very rare, don't often happen, true obstetric emergencies that you need to just go under for. But it's a great idea to express your preference that, what are my options if I'm medicated and then I need a surgery, and what are the options for me to like not be totally out or kind of forgetting everything. It's really important for me to remember. And in most cases, they should be able to give you that safely, give you all those options really safely. And then, these are kind of other, I'm really interested. You mentioned you have some criteria that'll kind of be on this right page. I'm kind of curious what your criteria is for a C-section. We'll get to that in a second. But on the left here, these are just common OB interventions. When you're telling me your first birth story, I know you've experienced a lot of these already. But can you tell me, is there anyone that you are like unsure about or you have questions about? Any of these?
I know that I am going to be open to intermittent monitoring, because I know a lot of times some kind of monitoring has to be like with a VBAC. Like most hospitals won't be like no monitoring at all, and I understand that. So I do plan on refusing continuous monitoring. I'm open to intermittent. I'm open to a HEP lock. I do not want fluids like pumped into me. I was very swollen after my son because I had so much fluid pumped through me. And my son was also, his birth weight was very inflated. He came out looking kind of like the Michelin Man, like all swollen and but I'm not completely against an IV. I'm open, because I know sometimes you might need those for, in case of an emergency. I'm open to like a hep lock. Definitely don't want my water broke again. Let's see. No Pitocin unless it's like
Yeah.
that's a big no for me. I don't want internal fetal monitoring. I did not have that with my son, but I'm not interested in that unless it's like an absolute necessity. And I know that sometimes they say it is, but it's not.
Yeah.
So yeah, I mean, there's some things on this list like I'm, like I'm open to the intermittent monitoring. I'm open to it like a hep lock, IV.
Mm.
And I mean, like I said, if it is a true emergency, then I'm willing to go forward with another cesarean. But these will be my guidelines. Like
Yeah.
my
What are,
birth plan will include cesarean section guidelines.
yeah. What are those? That's kind of this question of like what situations or scenarios might make you alter your preferences. I'm curious, just what are your, like, how will kind of you, what will help you know if it's a true need or not, you know?
Um, I really I've thought about it, and like I'm really not sure like what my expectations are for me to be like, okay, I need a cesarean. I guess maybe if
Hmm.
um like if it truly was a life threatening situation, like either me or my daughter, like
Hmm.
they're like this. And I know it's hard to say like what is that, because they can say that, but is it truly. I plan
Yeah.
on asking for a second opinion. Let's put it this way. If they
I-
come to me and say,
Hmm.
you need a C-section because this XYZ, I'm gonna be like, I would like to talk to be evaluated by another doctor or midwife, or
Yeah.
I will ask for a second opinion.
Yeah.
And I just heard, I've read stories of moms, especially VBAC moms, who just they knew something was wrong, and it was like, okay,
Yeah.
this needs to happen. Um,
So checking your like
and
internal, like checking your gut is going to be a big part of that.
yes, yes.
And a second opinion. Um, yeah, those are good.
And I feel like if it's truly a life threatening situation, like I will know. Like
Yeah. Well, I was going to say that's one thing I'll usually counsel people is to encourage, in an encouraging way. Like if it's a true emergency, there's not time to talk.
right.
If you have time to talk about it, it's not an emergency. So,
Yeah.
which is kind of comforting, right? Um,
Yeah.
and and that's, it's again very very rare, you know. And even then, like I've kind of seen, I've seen the same emergency happen, and in one case it was like, okay, we think this is happening, but like your baby's heart rate's fine, like you're fine, everyone's fine. It was like an hour before we went back to the OR. And then I've seen the same emergency happen again where it was like, we are not talking, we are getting a baby out.
Yeah. Yeah.
And it's kind of encouraging. Like I think we use there's, I think we need to kind of work on how we talk about cesarean, because there truly are emergency cesareans. And then there are like urgent cesareans. This is important, this is urgent, this will need to happen, we're going to be watching you really closely. But if you've got like 30 minutes or an hour to wait for the next operation to finish, does that make sense? We really need to kind of work on that heightened language around surgery, I think, to help parents understand what's happening. And also to truly reserve that, like, this is a true emergency times for when it's actually like a true emergency, and not something that's like, this could become an emergency, or we've been in labor for 5 days and you've not had a baby yet. I think this is the way to go. Like, there's times where that's not an emergency yet, we just kind of know it needs to happen. Or again, sometimes C-sections are to prevent an emergency that we see as imminent. And then sometimes there's actually like a crisis happening. And
Right.
when you get back there quickly, that moment is like very rare. That's like the general anesthesia, you know.
Yes. Yeah. And that's what I'm like, because I mean, I requested my son's medical records and my OR report, and
Mm,
there was truly no emergency. They put in my report that it was failure to progress. And I was like, I hadn't even been here for 24 hours.
yeah. 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 I'm glad you got your records. That's a good.
Yes, yeah. Because I remember telling my husband on postpartum that I felt like I was kind of forced into it.
Mm,
And I said, the one thing that stuck out to me that I guess I should have researched more into the hospital before I gave birth there was when I went in at 4:30 that morning,
mm,
there was three other moms on that floor giving birth, you know, all
mhm.
there. Out of us four women, there was only one that had a vaginal birth that day, and she was a teenager.
Yeah. Yeah.
So yeah, all of the rest, the me and the other two, we were cesarean, and I, of course, you know, they had us like walking up and down the hall, you know, in postpartum. So you know, we would like be pushing our babies in the little
Oh,
bassinet, and we would like stop and talk to each other. And by talking to them, like I quickly figured out that theirs was not emergency either, and it was more of a convenience thing.
yeah. And that's kind of a good, like you mentioned this, you know, looking at your hospital's cesarean rates, asking your provider, what's your cesarean rate? What's your VBAC rate? That's often often your provider's preference and their record of what they providers will tell you. I prefer to do C-sections. I don't like vaginal birth at all. OBs will say that, and that's helpful information for you to know. Well,
Right.
great. If I want a C-section, you're the person to be with. If I don't, I might need to
I
to
need to go somewhere
evaluate
else.
this.
Yeah.
Yeah. Or no, I'm coming in with some guns like blazing. I'm coming in with like, and even saying, I know you preferred this. That is not what if that, some people that's their only option. So I feel like if you're able to switch, that's certainly always a choice. If you're not able to switch, just know what you're walking into and know, okay, your options are different than my options. But looking at rates is really good. Really, really helpful. Your individual providers rates, because sometimes there might be a hospital that has one number, but if you know, like, hey, this practice actually does a really good job with like VBAC. So I can kind of finagle, and not every practice does that. There's only a few around here locally that I know that will actually share their records publicly. And I think that's great. But you can always go in as a patient and ask, as a doula too, like I do my best every year to kind of get the local statistics for the area. And I'll just share that with people, like, here were the rates, here's a C-section,
Right.
here's the inductions, here's the episiotomies, so people can know what's going down, and make decisions. But it's also not, I like to encourage folks to, like, don't feel poorly, at all. Don't feel like it's my fault. I should have known this. It is very reasonable to expect. I should be able to go up to a medical facility and expect top quality care. Sometimes people will say, like, I should have known, or I should have known I needed to look into this. How would you know that? You should be able to walk up to a hospital and get, like, what is the best quality of care possible. And it's a comment on the system that we're not providing that. This America isn't providing that consistently for moms, and we need to be. That's not a fault on you for not knowing, like, oh, I needed the secret decoder ring password to, like, figure out what was going on, like, that's not your fault. Like,
Right.
made it this far in the video, I want to thank you so much for soaking in this content. I've been a doula since 2015, and over time, some of the best ways I have learned is just by observing, watching, listening to other professionals in the field do what they do. And that's my hope with these videos, is to use the power of technology and YouTube and Zoom recordings to share some of my process with you. So if you've not already liked and subscribed to the channel, please do so. Leave a comment if you have a question for me. If you've got a question about something I said, said, or the way I handled a part of this, prenatal appointment that you saw, or if you want to know something else about doula work, I'm really happy to answer that. So thank you for your time, and I'll catch you guys in the next one.